Good evening, everybody. I'd like to call to order the May 9th Program and Budget Meeting, and I'm going to start out with our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. All right, we have a lengthy agenda tonight, so we're going to try to cruise through this the best we can. I will take a motion for the adoption of the agenda. Motion by Commissioner Birdie, support by Commissioner Vosberg. All in favor signify by saying aye. Aye. All opposed? All right. The agenda is adopted. Next is hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Please give us your name and your address.
Good evening, members of the Community Mental Health Board. I'm Sean McGregor. I live on St. Clair Avenue in Macomb County. I firstly wanted to personally thank Linda and John Kay for bringing up and discussing CEO's 11% budget cut being restored at the previous full board meeting on April 26th, so thank you. That being said, I wanted to address the importance of our company and how it positively affects the lives of the individuals we serve. And if I may take time to ask everyone in this room who's here on behalf of CEO to please stand up. At CEO, we believe that all people are entitled to respect, dignity, independence, community integration, and the opportunity to make choices in their own future. This 11% is crucial to CEO. It provides door-to-door transportation for the individuals served to community centers, employment, volunteering, and community integration. CEO also allows for individuals with intellectual, developmental disabilities, and mental health recovery to gain valuable skills which can lead to living more independent lives. CEO also offers creative academies where individuals served select classes in art, music, nature studies, community explorations, science, fishing, and bowling. Due to the budget cut we have had to close our Shelby location, which was our first CEO. With 11% restored, it would help CEO recruit and retain staff to provide quality services along with being able to purchase vehicles that are so desperately needed to replace the aging ones we have now and to embrace and secure home and community-based services. CEO has commission of accreditation for rehabilitation facilities for community services, CARF, since 1999. Since then, we have had very few to no recommendations last year. Case in point, CEO having 0 recommendations through CARF. CEO last Medicaid audit with Express resulted in 96% correct with no exceptions. At CEO, we have agreed that all employees follow by, that they will follow all guidelines in the CEO handbook and will follow individuals' plans of services, while always using the principles of gentle teaching when interacting with individuals served, while acknowledging that their relationship to the individual served is an integrated experience, while also protecting the rights of the individual served, ensuring that their IPOS is followed, and also being a proactive leader to their co-workers and individuals. With all these high accommodations, accomplishments, and achievements, I believe it to be an injustice that CEO was the only provider to take the 11% budget cut in Macomb County, and it's been little over a year since. Thank you for your time and consideration of restoring the 11% that CEO so desperately needs. Thank you.
Thank you. Anyone else from the public?
My name is Craig Maurer, and the address is 1106 Fornita Court, Shelby, Michigan. My purpose for this evening is the budget cuts. I work at CEO, and I did, and I'm working, and I'm maybe going back to CEO pretty soon, hopefully. I've been tortured in group homes and been pounded around so many times, and I had a lot of times where I was beaten and robbed and jumped and thrown into places. I even got tossed down laundry chutes.
What happened to your services?
They got disrupted.
Disrupted, or do you have services now?
No.
Why not?
because of the budget cuts.
Do you need them?
Yes.
What happens if you don't have them?
I can't help myself. I get sick, and I have AFib and all that stuff, and I have ostomy, and I need the services bad.
Right.
And on the other hand,
What can they do?
what can you do to fight them, to get them back? Yeah, fight them.
Is that it?
Yes.
Anything else?
Yes. And I also been beaten and robbed. I've been on roofs of TV antennas.
Where do you live now?
I'm living in my own
Do
house.
you like it?
Yeah,
How much?
very much. And I like to get back to CEO soon.
Are you a proud homeowner?
Yes.
Okay.
And I would like to get back to CEO as soon as the month before the month of May is gone.
It's a good workshop, isn't
And
it?
it's a good workshop. And I also, when I get back, I was going to apply for a second job.
Okay, what do you tell them?
That was my prophecy.
What do you say?
Thank you.
Okay.
Thank you. Anyone else from the public?
Good evening. I've got copies of the written testimony. Can I?
Yep, absolutely.
My name is Dennis Bott. I'm the CEO at Mork Inc., and I'm here to discuss the board action request for approval for the Mork rate modification. Most of you know, Mork has been a pretty solid partner with Macomb County for now over 45 years. And I think the evidence over the last, I provided it for you over the last 10 years at least, shows that that we've not only been a responsible partner in terms of the care that we provide to people, but also financially. We have been on a net cost contract, and every year for the last 10 that I've was able to go back, we've returned money back to Macomb CMH. The rationale that's listed in the publication today says that the reason is that the Mork contract moved from net cost settled to fee-for-service on October 1st, and the intent was to achieve cost savings or at a minimum remain cost neutral. Well, I can tell you that in February 2017, when the fee-for-service was first proposed, we objected to that, and really the basis was because healthcare is moving away from fee-for-service funding. It's moving towards a capitated funding model, which quite frankly the net cost contract that we have had with you is kind of was ahead of its time, and we started that 21 years ago. So I think there for us we had concerns about that. In addition to that, there have been publications. Certainly, this isn't the only one. I've cited one that was done for the state of Michigan in 2005, and the authors there note that we conclude that capitated managed care will cost the state of Michigan significantly less than state funds, and fee-for-service claims reflect higher utilization levels and high state administrative costs. And so for me, it came as no surprise when the next statement in the rationale was more service utilization is trending significantly higher than anticipated and compared to previous years. And again, remember, you can't really compare a fee-for-service year with a net cost year. They're kind of different animals there. So I think it's important to point that out. We're being penalized right now for delivering services that were deemed medically necessary and were authorized by the Macomb Access Unit. This isn't something that Mork generated. These were actually, we generated the service plans, but then they were subject to review and approval by Macomb CMH, and that's what we delivered, not more than that. So the rates that are being proposed tonight, we first saw last Friday on the 4th, and we were shocked to see that the rates are being reduced anywhere from 18.5% to 83%. I mean, the only justification is that these rates reflect network averages, but the averages that are reported through the state reporting mechanisms by Macomb County indicate that rates are much higher than this average, so we don't know where that came from. We asked for meetings with the administration to compare our financial data with what they were seeing, understanding that there may be differences in methodology, differences in terms of analysis. So, and frankly, our information shows a much lower result. As a matter of fact, we'll be reporting to our board next week that we anticipate a loss on the Macomb County contract this year, not a big gain. So far, we haven't been able to actually have those meetings, and we certainly haven't had one since last Friday when we got these rates. I'm here to tell you that MORC won't be able to sustain our current level of service at these rates. We won't. So I guess what I'm respectfully asking is that the board consider at least, tabling this motion and this idea for the time being until we can do that proper kind of discussion back and forth with the Macomb staff, by the way, for whom we have a lot of respect for, and really see if we can't come to some kind of a meeting of the minds that's going to allow us to preserve the services that we have. So I thank you very much. I appreciate it.
Thank you. Anyone else from the public?
My name is Debbie Coppola, and I live here in Mount Clemens, but I work at CEO. And last month I came and told you some of the things that we do. I'm part of the art department. But tonight I wanted to give you an example of all the wonderful things we do. I want to talk about an individual that we're going to call Mary, okay? Mary came to me a year and a half ago, and every single thing she did, drawing one line, it didn't matter what she was doing, whether it was paint, drawing, whatever, everything she did, she asked, is this right? Am I doing it right? Am I doing it right? Is this okay? Every single line she did. And after working with her and telling her, Art, there is no right or wrong, that it's your interpretation, how you feel. If it makes you happy, then it's right. And after a year and a half, this young lady, the same little girl that couldn't do a line without an okay, is now teaching other people how to do things. She is leading other individuals that come into our room as a new person and teaching them how to do things. She has learned how to use a sewing machine. She has made things on a sewing machine, and just wanted to let you know, just wanted to give you an example of how wonderful all of these people, they all love their job as much as I love mine. And it's important that we keep this going. Thank you.
Thank you.
I don't know if I can
Here, do you want the microphone
reach the
down
microphone, but
closer? There, is that better?
maybe. Hello, can you hear me okay? Yep. All right, my name's Chris Meadows. I was here about a year ago, I think, and spoke with you about my benefits being cut. And as a result, thank God, through all your hard work, I was able to get the benefits that I needed to keep my independence. Now, a year later, I'm facing cuts again. They want to take 8 hours a week, a day away, which left to myself, I couldn't do anything. If there's an emergency, I can't reach a phone. I can't use the bathroom. I can't get a snack. I can't drink any water. I can't even drive my wheelchair. So what I'm just can't understand is what's changed in that year as far as my level of need. I understand that there is a budget and everything like that. But the fact that it was approved the last time and now all of a sudden it's different, it's really troubling, and it affects my ability to be independent. You know, I'm a contributing member of society. I work, you know, I pay taxes, I do everything I need to do. I maintain a home, you know, everything I need to do. And I've complied with every request that the county has made as far as looking at other avenues of care. And all of them I was denied for. So if I'm not eligible there, I followed every, you know, instruction, every detail of what I was supposed to do. Why am I being penalized now? And it's only been a year since the decision was made that I needed that level of care. So I just wanted to try and make you understand what I'm losing, how it's affecting me. I have no other way to do anything for that 8 hours. And I mean, even if there was an emergency, you know, what am I going to do? I can't call 911, that's for sure. So I just wanted to make that known. And, you know, I will be going through the appeal process as I have to. But I just don't understand what has changed so much. Thank you.
Thank you.
Hi, my name is Sarah Miller, and my address is 20304 Gawkler in St. Clair Shores. I have been a friend and a caregiver for Chris Meadows for over 10 years, and the issue of losing his home help services has been addressed before, and I just wanted to say thank you for addressing this with him in the past. He has always received home help 24 hours a day, 7 days a week. And at his last 6-month review, he received a letter saying that he would lose 8 hours per day of these home care services. As Chris had indicated, nothing in his situation has changed since the last decision that would cause him to need 8 less hours of services per day. His level of need remains the same, and his medical condition remains the same. The home help hours are the most appropriate level of care for him. He doesn't belong in a nursing home because he doesn't need constant medical attention from a doctor or a nurse. Working with Chris as long as I have, when I am his caregiver providing these services, he does need assistance with everything. He can't eat unassisted. He couldn't call 911 if there was an emergency. He couldn't move around in his wheelchair without my assistance. And if there was some type of an issue with the oxygen that he requires 24/7, he could not resolve that issue, and that would be potentially life-threatening for him. He has complied with all the requests from the county. He is a contributing member of society. He did go to college. He worked for the federal government for 10 years, so if you got your Social Security check this month, you can thank people like Chris. He's an active member in the community, and the services have allowed him to remain in his own home. So our only request is just to continue the same services that he has received his entire life. Thank you.
Thank you.
My name is Helene Palmieri. This is my son, Michael Palmieri. He attends CEO. Up here, Mike. He's been there for 4 years. He left the ISD at age 26. He made a smooth transition, which was big time. He's a one-on-one, and he's doing real well just being here. I also work for CEO, so I see both sides of the coin. I understand, you know, that stuff happens, but 11% is a lot. He goes out in the community 3 to 4 times a week. He does go to the bowling academy and the music academy, so the things you're being told, I can tell you actually happen. Mike, come here. They've installed GPS tracking devices in the vans which as a parent, that warms my heart. They know where the vans are. They know how fast they're going. That's phenomenal. Just think of the recent gas price hikes. I don't even know the total number of vans we use, but in order to go out into the community, just survival, just to keep the level we have, whatever you can do to make that at least an equal playing field, we'd appreciate, because it's my understanding we're the only ones that got that cut. Mike, come here. Can you say thank you? Thank you? Come on, thank you.
Thank you.
There you go.
Thank you.
Hi, my name is Kelly LeBar. I'm a community assistant. I live in St. Clair County, but I work at CEO in Macomb County. I can tell you this 11% budget cut has really affected me trying to find outings for our individuals, like fishing. We have to buy worms, we have to buy hooks, we have to buy the poles. This 11% budget cut is really hurting us because if something breaks, we have a hard time replacing it. So we're going to garage sales and we're utilizing our resources, but it's getting harder and harder. And the individuals really love coming and going out in the community to fishing, music class, all these other activities that they do that otherwise they wouldn't do in a group home. The GPS trackers are too. I go out and community monitor the groups to make sure that they're doing what they need to be doing. Also, this 11% budget cut and you guys upping the ratios, a 1-to-6 ratio in the community, if you guys up it any more, it's really gonna affect some of the individuals that need more one-on-one attention time. The ones that have a little bit harder time walking on the gravel, you want us to look after 8 individuals per 1 staff. That gets very difficult too. So if there's some way you can restore this budget cut without making things difficult for the staff and making things difficult for the care of our individuals or the safety of our individuals, which is our main concern, it would be very great. Thank you.
Thank you.
Hi, my name's Thomas Miller, guardian of my son, Jason Miller. He's been going to CEO for 6 years now. Enjoys it. We understand they closed the 23 My Road, moved to 26 in Washington, from Shelby to Washington. We understand cuts. There's always cuts in everything. But these individuals need this stuff. And one of my other complaints with my son living in a group home, he lives at 39-911 Corolla. They're supposed to have 8 people working there, 2 at a time. They don't. They haven't for the last year and a half. They're always short-staffed. Have one individual's in a wheelchair. I happen to be the house he fell out of it. I had to help the poor worker get him back in his wheelchair. This is unacceptable. I mean, by any means. You can't treat people like this with it, no matter what. And this has been going on way too long. Where's the money going to? These people are paying into this home. My son and the other 2 individuals are paying buku money to this corporation and not getting the care they deserve and need. You know, and something's got to be done. And if it's not done by soon, I guess I got to retain somebody, I guess. I don't know what to do about this. This is sad. It's, you know, if you don't have a child like this, you don't understand it. I guess you guys all probably have seen it, you know, because you're on the board. But budget cuts, yeah, it's going to hurt, and it's not fair. Life's not fair, but they've been drawn a short card, and it's not fair to them. They're born this way, or a car accident, whatever it may be, and they should be taken care of by all of us. We pay a lot of money into taxes. Yeah, we understand. Things have to be taken care of. I help out my kid as much as I can. I'm retired. This is it. So thanks for your time, people. You have a good night.
Thank you.
Thank you.
Hi, I'm Steve Johnson, 47691 Glody Road. Macomb County resident, and I've had the pleasure of calling Chris Meadows a close friend for nearly 30 years. He's more like a brother to me. I want to start off by saying I'm very sympathetic to your drastic budget cut. It's a terrible predicament for so many deserving people, and I can't imagine being in your shoes and having to pick and choose who receives less. At the same time, I have no choice but to stand up for my brother. The man deserves the quality of life that he's worked so hard to obtain. And he requires the same level of service that he always has. Reducing the hours of staffing that he receives just isn't possible. Unfortunately, he needs someone with him at all hours of the day, even when he's sleeping. He can't get up at night to go to the bathroom by himself. If there were a fire at his home, he may not be able to call for help. He is still very independent. He just needs some help. About this time last year, Chris was faced with the complete removal of his services, and he was able to appeal that and was allowed to continue receiving the same benefits, and I'm very grateful for that. Thank you all who were involved in helping to allow that to happen. He's defied all the odds throughout his life. He's accomplished more than many able-bodied people have. As a young child, he was diagnosed with muscular dystrophy and given a life expectancy of late teens to early 20s. And despite that diagnosis and despite being confined to a wheelchair at a young age, he got nothing but A's throughout every, elementary grade, high school. Was accepted to Michigan State University, graduated in 4 years, became a federal employee, purchased a home, had that home equipped for his needs, purchased a van, had that equipped for his needs. He's still an active member of society. He, goes to stores, eats at restaurants, buys groceries. He has staff there to help him, but he needs them to cook the dinner, not anything else. He's a positive role model for many young children with muscular dystrophy. His success story has provided hope and inspiration for many of those people affected by that terrible disease. He's one of the oldest living survivors of Duchenne muscular dystrophy, and he truly deserves and appreciates the help that he's received. And I truly hope that we can find another way to continue his services as he's had. Thank you.
Thank you.
Good evening. My name is Kara Flockhart. I'm a program supervisor for CEO. I've been employed with CEO since 1998. I'm also a Macomb County resident. I reside at 49967 Pembroke, Shelby Township. CEO provides services for both OCHN and MCCMH adults with intellectual and mental impairments. We provide supports and guide and assist individuals towards their vocational and non-vocational goals, which I'm sure you guys have all heard over and over again recently. In April 2017, we received an 11% budget cut through MCCMH funding. This has seriously impacted the services through the closure of a program location in Shelby Township, which has been there almost as long as I've been employed with CEO, and has put on hold the purchase of many needed new vehicles. We desperately need the 11% reduction restored to help replace aging vehicles and to embrace the home and community-based waiver or base services. This funding is also needed to recruit and retain staff, which is seeming to be a growing problem by the day, and also to provide quality services. I hope that you will see the value in these services that we provide, as you've heard here tonight already. We provide to individuals, and it is important that the 11% budget is restored to allow us to continue to provide those services for so many people who rely upon us and those services. Thank you for your time.
Thank you. Anyone else from the public?
Good evening, board members. My name is David Meadows. My address is 34625 Mulvey, apartment 140, Fraser, Michigan, 48026. I'm here tonight to talk to you guys about my son, Chris Meadows. Now, you've heard other people talk about him, but I'm his father. And I proudly wear this shirt because it indicates that he graduated from Michigan State University, which is a very huge deal. I don't know if, I'm sure all of you folks went to college. And for him to do this in 4 years out of a wheelchair without my help, who I helped him for 11 years before he went away to college on his own, he depended on his friends for help. And they helped him get through 4 years of college. And as you've heard, he graduated, went to work for the government, now as a homeowner and paying taxes every year. Now, I know that you guys have a very strict budget, and I know that things are hard everywhere. They're not easy to get through these times. But Chris needs this help drastically. I do believe that he is the oldest living Duchenne's muscular dystrophy person in the entire Midwest. This didn't come through without hard work. He sacrificed many things in his life, gave up all the things that he would have loved to have done, playing baseball, running, doing all the things that normal kids did, to go in a wheelchair at a very young age, as you've heard. Chris is a very deserving man, not because he's my son, because he is a tremendous role model for other people. Everyone he's ever met or been in contact with have always come away knowing that he was a good man and he was very, very independent. I taught him that from a young age. You know, you have to be independent, and he is. We lost his brother in 2010 to this same disease. They were both born with it. But they worked their way through it, and they have been functioning people with the help of services. I do believe in my heart that because of those services, they were able to do and become the people that they are by being independent and being able to pursue all of their interests in their life. And I appreciate more than you'll ever know all the work that you folks have done to help keep his services through the last year. But now here we are again. And like you've heard, nothing has changed. Chris is not miraculously well. He is still in a wheelchair, and he can't do anything for himself. So if anything that you guys can do to help his situation would be, from my heart, most grateful. And I thank you for your time.
Thank you.
Hi, my name is Donna Abbott, and I've worked for CEO for about 10 years now. I live in Shelby Township. A lot has already been said. We've lost in our budget. We do this program, that program, and the other. But what I want to tell you is when you walk in the morning, every day when you walk in, I experience this. They want to know where they're going. They're so excited. They're visiting their friends. We just had a girl that had to do a spin down and came back today. Well, she just could not wait to see her other friend. I mean, just imagine your friend comes back from Hawaii and you want to hear everything about it because you missed them. Well, this is how we feel. This is how they feel. They feel the same way we do, and that's the services we provide. We provide services that make them excited to be there. As you know, you are excited to be at your job, they're excited to be at theirs. And to me, I mean, when I see all that and them playing basketball and hanging out together and making new friends, and when we merged, because we are great employees and we made the sacrifices to make sure they feel secure, our merge went well. So I think you need to really think about how this is impacting them. They need a good place to go, and we are definitely it every day. They feel very secure there. It might be the only place they feel secure. But I know coming to us and being with us, you can tell. It's in their face, their eyes, the way they act. It's everything they do. You can tell. I mean, if I came up here moping, you're going to know I'm not very happy, right? If they come in moping, we know it too. So we're like, well, how do we help you get over this? We are very important to these guys. I feel very important. I feel very privileged, to be with them, to know that I'm making a difference, and all of us are making a difference. CEO is like a family. We all do this together to make sure we're making a difference in their lives, and that's what I want to see. Us reinstate the 11% cut so that we can do a little bit more with them. And I don't know if they mentioned, but we also do job coaching. They love that. They feel like, okay, I'm doing something productive in life. So please, give it some thought. I know you can only do what you can do, but it is very important to CEO and the individuals. So thank you for your time, and have a good evening.
Thank you. Anyone else from the public?
Hello, my name is Herb Killian. I live in Shelby Township. My daughter Paige is my oldest daughter, and she's 27 years old and extremely autistic. She requires 24-hour supervision. It's been a trial on my family over the years, as you can imagine, and I'm not going to go into details about that, but over the years I notice that a lot of people say to me, friends, acquaintances, family, people that I just met sometimes, I don't know how you do it. That's the quote, I don't know how you do it. And I never know how to reply or whether I even should reply, or because the answer is always so multifaceted, and a lot of it has to do with us being able to do it and get through it as a result of all the educational opportunities and experiences she's experienced over the years. She's 27 now. She graduated last year, or completed, as they say, at age 26, and that's the reason we could do it all that time. Now she's 27, and she's at CEO 3 days a week. We hope to make it 5 days a week. We hope not to experience continued cuts so that she cannot get up to 5 days a week or even stay at 3 days a week. This is the kind of thing that helps a family stay sane. My daughter requires 24-hour supervision. All the people that say, I don't know how you do it, never ask, can we help you? CEO is helpful in many ways, and without it, I don't know where we'd be. We'd be at a point where we were in between school and CEO. My other daughters, one of who was 14, has to deal with that because we constantly have to rotate and can never get any kind of fixed lifestyle in place. CEO allows a time frame for us to do what we need to do without completely being shackled. And I know that sounds real selfish, but sometimes I have to be selfish. And I think these cuts are something that have to be well thought out. You have to look at the individuals here. You have to think about the people who couldn't make it here because they are tied down. I have somebody watching my daughter right now. That's not always the case. Sometimes I have to leave what I'm doing. If you have cuts and you need something done, I'm a pretty handy guy, pretty good handyman. I can fix things. For example, at the facility, I can shovel the sidewalk down on the street, but I don't want to hear about cuts to the people who need it, who were born that way. My daughter doesn't choose to be a problem, but sometimes she is. And organizations like this are very helpful. And the fact that it's the only community mental health provider, I don't know if I'm wrong or not, that suffered a cut last year, I don't know. How do you make that judgment? If it's a coin toss, I can understand that because you gotta make a decision somehow, but there has to be a better way. That's all I have.
Thank you.
Hi. My name is Derek Harwood. I am from CSDD. Currently, to my knowledge, all day programs are receiving the same rate. So therefore, I think if one provider gets a raise, I think all providers should get one to be fair and consistent because I believe all providers were cut. Thank you.
Thank you. Anyone else from the public?
My name's Dave Clemens. I don't have a fancy speech or anything. I've worked for CSDD for 8 months. But what I do have is the knowledge of what I see in the company. I've been a supervisor for 29 years. I've sat on your side. I've sat on the other side. I have 3 degrees. I don't really have to work at CSDD. I could go anywhere. I choose to work at CEO. My wife works at CSDD. Sorry, Hon. I work for CEO. And I know how hard we are struggling, and as you have heard, it's a fact. And it's a challenge. You don't know how many times I've been kicked, punched, spit, and socked in the eye. I've been hit in the eye so hard one time I couldn't see for 45 minutes. But he could have hit me in the other eye, and it wouldn't have bothered me in a minute, because I see the need. The reason I'm here is also to speak on my company, but to speak for those that can't speak. And what my speech is about, as Mr. Shawnette was sitting here, was dignity. Y'all have dignity, right? We all have dignity. These folks don't have dignity because they get stripped every day, their dignity. One of the functions that we have is we deliver Meals on Wheels. Meals on Wheels gives dignity to those that worked in the community, can't work anymore, sit at home, are in wheelchairs, and are old. It's a joy to watch these guys take a meal to the door, come back and tell me, he said, hi. He said, how you doing? Have a great day. That made their day. And these people that receive the Meals on Wheels get dignity. But yet, these people that can't defend for themselves, they're dependent on people like me, get zero dignity. And I don't understand it. If you're going to make a cut, make it a cut in Meals on Wheels. Take the food away from the people in the community. Oh, I can't believe he said that. Well, those people can defend for themselves. These guys can't. I walk up to $450,000 homes to get a meal on wheels. I'm not saying that they don't need it. They do need it. But I'm saying is these people need it more. CEO, they shut a CEO down. If there's 11 people that got laid off, each individual that works there has to control 6 people. Do the math. 60 people in the community have no place to go. 11 workers lost their job. 2009, I lost my job. I never thought anybody could steal my dignity. Like I said, I've been a supervisor 29 years. I worked for Dick Cheney in Houston. If I was your boss, I called you in the office, and I said to you guys today, I'm shutting the company down. You guys are laid off. How would you feel about your dignity? Because that would strip your dignity. And that's what we're doing to these people today. There's a little guy, I can say his name because he's no longer with us. His name was Tommy. I got to teach Tommy. I got to pray to Tommy. And it was hard because I had to hand feed Tommy. Oh yeah, I've wiped his butt. I've mopped his face. I've changed his clothes. And I'd do it again in a minute. Well, when I went to the funeral, I was heartbroken because Tommy became a friend. Well, they tell you in this business, these guys ain't your friends, but they are my friends. I tell them every day how much I love them, and I tell them I care for them. Well, anyways, as I was sitting there observing Tommy, his uncle was standing next to me, and he said, Tommy was not always in a wheelchair. Tommy carried his Bible with him all the time. I said, man, I knew I got through to him when I was praying with him and when I was teaching him prayers. I said, amen. But you know what? Again, don't take these guys' dignity. It's not right. You guys have a good night.
Thank you. Anyone else?
I moved with his speech. I just said, all the, these special people. My name is Bonnie. I live in Shelby.
Can you move a little bit closer to the microphone, please?
Oh, okay.
Thank you.
my name is Bonnie. I live in the Shelby Township. This is my daughter. She is Jeannie. She's autistic and deaf. She attend the CEO daycare program many years, I think. I think CEO, provide very excellent all the service. They can go to the community. They let them boarding, even like they go to the We Are Meal, program, all this one. So I think important, just like the man said, give them the dignity. They are individual. They are special, people, but they deserve what we, can get it. Even last week, CEO hold the party. Every year they hold a party for all these special people. I really think they, give the best service for all these special people. They really needed the service, Just like the man said, they couldn't speak by themselves, but they are vulnerable group, So I really thank you for all your board guys. Think, this group of people. Thank you.
Thank you.
But I want to say one thing. I really appreciate all the CEO employee. They do their best job. Sometimes they short staff. They even put the people in their office or staff. I really appreciate. Thank you.
Thank you. Anyone else from the public?
Good evening, members of the Community Mental Health Board. I'm Jenny Whitmer. I live on 533 State Street in St. Clair County. I am the program manager at Creative Empowerment Opportunities at our Inkerville location. I wanted to address the necessity and opportunities and value at CEO. At CEO, we believe that all people are entitled to respect, dignity, independence, community integration, and the opportunity to make choices in their own future. This creed I have lived for over 11 years. With that being said, at CEO, we offer community inclusion to the individuals served. CEO has partnership with MVETS, and we do Christmas caroling with the individuals. In return, they have picnics for the individuals in the summertime and offer other various parties between CEO and MVETS. This builds this healthy relationship of the individuals being more integrated into society. The individuals can volunteer for Focus Hope and Meals on Wheels. Without the proper funding or budget cuts, this in return will lead to an interruption of meals being delivered to senior citizens across the county. Our individuals and the role they play in society can lead to a systematic collapse of our community, and the rates continue to be cut. Our individuals also have the opportunity and choice to attend CEO activities such as the DIA, the circus, Lorenzo Center of Learning, Amarita Fair, and the ice shows. While we offer all this, a diminish in funding would hurt and greatly affect the people we care for most at CEO, the individuals we serve. A restoration of our missing 11% would greatly benefit the individuals, the community, and CEO. We will be able to afford more vehicles for the fastly growing attendance at CEO across all locations, while expanding our endeavors to new locations and also being able to afford community-based integration activities. Thank you guys for your time.
Thank you.
Good evening. My name is James O'Tenney. I live at 22448 Gascony in East Point. Do the right thing. I have 2 boys and my beautiful daughter, Jennifer. Jennifer was always a special child. Apple of my eye, some people would say. I remember her first job, McDonald's. Boyfriends, girlfriends, graduation, looking through dorm rooms. My baby going away to college? Wow. Another boyfriend. Married, but you're so young. First grandchild? My wife and I never dreamed life would be like this 50 years ago when we first met. Now we've been married 46 years. And it's not. My daughter is going to be 38 tomorrow. Jennifer is sitting in a group home tonight. My wife and me have never experienced a typical upbringing of my daughter. Jennifer is developmentally disabled. She has the IQ of an 8-year-old. There are only 3 things that Jennifer really likes: eating, going to church, and going to CEO to help out with Meals on Wheels. Do the right thing. Thank you for your time.
Thank you. Happy early birthday to your daughter.
Hello.
Hi, my name is Ursula Peron, and this is my brother Jeffrey Peron, who I am speaking on his behalf. His address is on Meadowdale, right here in Mount Clemens. He is a resident of, as well as myself and my father. Jeffrey has been a member, a participant of CEO since 2004. CEO is the only program that we have found without bias, without prejudice. Jeffrey is 56 years of age. As you know, the state of Michigan only entitles them schooling up until their 26th year. That's 30 years of finding programs, searching them out, and allowing a person such as my brother, who suffers from autism and is behaviorally affected. Not all of the programs out there allow individuals such as my brother to stay in the programs because of the behaviors. CEO is the only program that has kept Jeffrey in the program and are not biased to him or because of his behaviors. They have an incredible staff, loyal, devoted, who have worked with him socially, out in the community, personal situations, constantly working with him, with other members of CEO, other participants. He works in the community for Meals on Wheels and likes that job and receives his accomplishment of achievement plaque every year for that. He's very proud of that. He does work in the community with garbage, and he goes out and has a social time in the community as well. We plead for the continued program of CEO so that the cuts do not affect Jeffrey and his fellow peers who are in a strong need to continue at CEO. Jeff, as well as these other participants, need purpose in their day-to-day life, like we all have purpose, the Monday through Friday basis. Without CEO, Jeff would not have a life except for the one that our family provides for him. And so many of the people who do attend CEO or other programs, such as without these programs, they would not have a life at all because many of their families don't step up in our family. So please give this great consideration to people like Jeffrey and the others. Thank you for your time. Jeff, say thank you.
Thank you.
Okay.
Thank you.
Good evening. My name is Sandy Dabner. I live at 645 Harrington in Mount Clemens. I'm a behaviorist for 14 families who attend CEO. 3 of them came up tonight to talk with you. My concern with the budget cuts are my families who don't have transportation. They would not be able to get to CEO each day that they attend in order to be with their friends, be in the community, and experience life in general. I also have concerns about how the ratio is going now. 8 consumers to 1 staff, especially at CEO Mount Clemens, where the vast majority of people are in wheelchairs. I've been there at lunchtime, and the staff is trying to get 8 people their lunch. Some people have to have liquid pumped in a tube into their belly. Some of them need food cut up. Some of them have choking hazards. Some of them just need help getting all this done. When I'm there at lunchtime, I help the staff out, and they really appreciate that effort. With CEO Mount Clemens too, most everybody has to go into the bathroom, and the staff has to help them, and that takes quite a bit amount of time as well. but they all enjoy going out in the community. I just ask that you bring back that 11.1% if you can, if you guys can. And if anyone ever wants to go to CEO with me and see all the people that I have, CEO Clinton Township, I have 8 consumers there. I'd be glad to introduce you to them so that you can understand what it means for them to be there. Thank you.
Thank you. Anyone else from the public wishing to speak? All right, seeing none, we will close the hearing of the public and we'll move on to item 4A. Request to approve fiscal year 2018 contract amendment number 2 between Michigan Department of Health and Human Services and Macomb County Community Mental Health for managed mental health supports and services. I'll take a motion to approve. Motion from Commissioner Vosberg. Support. Support from Commissioner O'Connell. Just A. Yep, we're going to go through these one at a time. John, did you want to speak to this one? Okay. Does anybody have any questions or comments on this one? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? All right. 4A passes. Next is 4B, request to approve fiscal year 2018 contract amendment number 2 between Michigan Department of Health and Human Services and Macomb County Community Mental Health for Medicaid managed specialty supports and services concurrent 1915 BC waiver program PIHP. Motion by Commissioner Bush. Support. Support by Commissioner Phillips. Any questions or comments on this one? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is 4C, request to approve veteran navigator budget. Take a motion to approve. Commissioner Birdie with the motion, support from Commissioner, is that you, Nagovin? Commissioner Nagovin. All right. Questions or comments on this one? Commissioner Vosberg.
Thank you, Mr. Chair. Just wanted to know, I approve the general concept of this, but how will this work in coordination with the county's Department of Veteran Services? And then also, are we just approving the base pay? Who's going to pay the benefits?
I'm going to turn it over to Jim. Yep. Jim's going to speak to
our navigator works in conjunction with Laura Rios over at the Veterans Navigator Program. Excuse me. The Veteran Navigator with us is a program that's funded by the state to provide veterans with a way to link to community services within the community, which is really complementary to what the Veterans organization within Macomb County does. There's going to be a little bit of overlap with that, but they have so far worked very well together in terms of making sure that their efforts are coordinated. Not all counties have the county veterans office, and so I think we're a little bit unique in that Macomb County has both. But the thing that this does for us is it provides a opportunity for somebody that comes through our door to, if they are a veteran, that we can immediately link them to the Veteran Navigator. They don't have to necessarily be eligible for CMH services in order to receive the services of the Veteran Navigator, and they can link them to other resources that are appropriate for veterans, the buddy-to-buddy, the County Veteran Service, other resources that are available to them that both take advantage of their insurance and are more sensitive to their needs. So it works in conjunction with the county Veterans Office as well. It is a contract position, so the benefit piece doesn't apply here. It's salary up to, well, it's a grant of up to $80,000 a year. We received $40,000 for the balance of last year, and then $80,000 for this fiscal year.
Thank you.
Yep, go ahead, John.
I didn't want to jump in front of anybody else, and I just wanted to introduce Mr. Schran. Want to stand up, William? And our Veterans Navigator, who's been with us now for, as Jim indicated, for the last 6-7 months. I received a report, or we received a report, I'll send it to the board here. Phenomenal the contacts that have been made relative to his efforts with the community and all of those agencies, veterans alike and unalike. I'll get it to you, just phenomenal work.
Thanks, John. Thank you for your work. Really appreciate it. Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is a request to approve Children's Mental Health Block Grant Budget. Take a motion to approve. Motion by Commissioner Birdie, support from Commissioner Schmidt. Any questions or comments on this one? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next is E, request to approve Adult Mental Health Block Grant Budget. I'll take a motion to approve. Motion from Commissioner Birdie, support from Commissioner Bush. Questions or comments on this one? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. All right, next is the approval of a rate modification for creative empowerment opportunities for skill building. I'll take a motion to approve. Motion from Commissioner Schmidt. Do I have support? Support from Commissioner Birdie. Any questions or comments on this one? Nick?
John, we did an across-the-board provider cut of 5% some time ago. How did a 5% cut turn into an 11% cut for one provider?
About 3 years ago, we did a 5% across-the-board cut. About a year ago, this board approved for Macomb County to take over the skill building providers that historically were provided in under the contract of MORC. And so there were 4 different rates. There was, I won't go into all of the HCPCS codes or the codes, but there were 4 different rates. There were our rates and there were the MORC rates. In some cases we were higher, some cases we were lower. But across all of those skill building providers, we dissolved the contract with MORC through the board approval here, and then we took over the administration of those contracts. In the process of doing so, we also ran statistical reports and data analysis. It's not stagnant. People are moving around from higher level or lower level of care, either community-based vocational services or facility-based services. And so when we ran the report, we came back to this board and said, look, our providers are we have standardized rates for most of our services. Our providers are gonna fall in the $2.50 per unit, per 15-minute unit rate, or the $3 per 15-minute unit rate. And CEO fell right in the middle at $1.75 per minute, $2.75 per 15-minute unit. And it wasn't only through a process of our finance staff continually renewing that information and reviewing that information and working with the CEO, as we have been for the last year, to realize that instead of getting the $2.50, that's where they got the 11%. They should have got the $3 rate. So that's where it came from.
And so how does this then relate to the other contracts we have for these services in terms of their rates? Are they all essentially standard, or are they over in different places?
Some providers, there were some that marginally or minimally lost a little bit or gained a little bit. There wasn't an outlier of this nature at 11%. I think we should correct it. I wouldn't say that a year ago, to have the money to correct it. Certainly, I'm not certain we have the money to correct it now, but it's the right thing to do.
Thank you.
Commissioner Phillips?
Well, I guess I had pretty much the same questions that Nick did. I heard them saying something about their ratios were different, 8-to-1. What is the standard for whether it's CSDD, life skills? Why are their ratios all the same? And then again, if they were only cut, they're asking for 11.1% increase, then what is to prevent the rest of them from coming through with that 11% if they're not getting the same thing across?
And there's nothing, the second answer is there's nothing to prevent the other ones to come back and say that they believe they're warranted of 3 or 4 or 5%. The ratios, there's facility-based skill building, and there's ratios for that 8 to 10 or 8 to 1 or 10 to 1, whatever that may be.
Okay.
And then community-based. So the intensity of if you have, obviously you have consumers out in the community and close to the curb and those types of things, greater, opportunity for dangers and unfortunate events, and the staffing ratio is better at 1 to 4, thereabouts.
All right, so that's what, guys, my question was. I just want to know, like, are all the agencies that the young adults attend, were all equally balanced? Or will it be equally balanced, I guess?
Their contract does require staffing ratios. It's in there, and we do monitor for that as well, too.
Okay, thank you.
Any other questions, comments? Commissioner Nagovin?
So the state, I'm going to go back on that to what they owe us for the $7.6 million. If we did receive that, which we deserve to get, would that be one of the agencies we could look at to fund them up to the 11% they're asking for, if we got that money back from the legislators that took it from us?
I wouldn't, if the question is should we use the monies or the potential monies that we're getting from the state to fund this?
Mm-hmm. Yes.
That's really just a finance, thing that we have to figure out. I wouldn't predicate the board to approve this based on the if we get the monies from the state.
Well, I'm not asking for approval if it is. I just want to use this for leverage on them to how important it is that we do receive the money that they took from us and how they're cutting back the programs. And if we did receive that money, it's a possibility we could reinstate what's been taken away that shouldn't have never been taken away.
I think if we find ourselves in better financial situations, which I believe we are every day, and that'll prove itself, hopefully, over the course of the next quite a few months when we submit our reports to the department, that we will find ourselves in a greater strengthened financial situation here, and perhaps restore rates and be able to offer up services that consumers are looking for that they haven't been able to receive so far.
And then I just got one more question. This is still being recorded because I noticed the monitors aren't showing up, but this will still show up in the website.
Should be,
I can
yep.
direct the legislators that live in Shelby Township to take a look at what's going on.
The red light's on. Not on your screen, but it's on in the back room.
Oh, okay, because my red light's on too. Thank you.
Any other questions or comments on this item? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. All right, on to letter G, request to approve a rate increase for New Passages Friendship House program for fiscal year 16-18 contract. I'll take a motion to approve. Motion by Commissioner Vosberg. Support from Commissioner O'Connell. Any questions or comments on this item? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? Motion passes. Next is H, approval of a FIA data development proposal. Take a motion to approve. Motion by Commissioner Vosberg. Is there support from Commissioner Schmidt, I believe? Yep. Is there any questions or comments on this item? Commissioner Shimatero.
Yeah, John, I think we need a bit of an explanation on this. I read through the materials, but this is a pretty large sum of money at a time when monies are coming out of services, and this is more administrative. Can you, and it's an open-ended contract, which kind of concerns me. It's one that just goes essentially forever unless we give notice not to, because it's automatically renewed. can you give us a little more detail on the program, its need, and why it's open-ended, and how we can afford it without hurting services generally?
Okay, certainly. This is the second item that Jim and I talked right before the board meeting. He was going to help me out on, and so I'm going to turn it over to Jim.
Okay.
Yeah, as we indicated in the board action request, there's really three major components to this proposal. One is the continued development of a data warehouse that we've been working on, and I'm going to pass around a handout that kind of supplements some of the information related to that. And I'll come back to that and speak a little bit more to that once the handouts get all the way around. The other area is the report migration from a obsolete reporting platform to a data warehouse. And we have been using a platform called Crystal Reports for many, many, many years. And the effort that it's taking to maintain those reports in that format, in that platform, has become time intensive and costly to continue to try to maintain that. Migrating those reports over to a data warehouse more automates that process and makes that information more readily available to all staff that need it. This proposal really expands the availability of data to staff that need the data in order to make decisions, and also to programs that need that data in order to determine how effective they are, how efficient they are their staff doing the activities in an efficient and effective manner. The third major area is a subject matter expert consultation. And really what that is the consultation with experts related to processes, related to data. What they'll be able to do is to look at the data, tell us how to better use that data, and then take the information that they glean from the analysis of that data and help us modify processes in order to be more effective and more efficient. So it really turns into an investment in doing business more effectively and efficiently. It'll allow us to better track outcomes and to demonstrate the effectiveness of the programs that we offer, which are two things that we feel like we really need to be able to demonstrate those outcomes from evidence-based practices and other programs to be able to demonstrate our value to the community as well as to other payers maybe down the road. The other thing that it'll allow us to do is if we are able to become more effective and more efficient, especially in the use of some of the high-cost services, i.e. the acute care inpatient services, we should see a reduction in those costs, which will be a return on investment that will allow us to invest those dollars back into the service system. The information that we will get from this data warehouse, and I think the handout is around to everybody now. This is just a snapshot of one of the pages from our hospital data warehouse that we've been able to put in place with some grant dollars up to this point. And as you can see, there's a whole lot of information here that tells us about inpatient hospitalization, acute care services, where they're being provided. Over on the left margin is by hospital, and I blacked that out because the detail that isn't necessary for the report. But it tells us when those hospital requests are being made, what day of the week. We also can look at it by time. That allows us to optimally staff the programs in a manner that says that, okay, this is going to be a peak time. We're going to need to have more staff on duty here, as opposed to having staff there when it's not a peak time, and therefore you have staff that perhaps aren't as busy as they could be. Also, to the right, it shows us what the disposition of certificate of need requests are. Where did a request for hospitalization end up? Did it go to inpatient hospitalization? Did it go to partial hospitalization? Did it go to crisis residential? Was it denied? And we can get percentages for each of those. Then we can drill down even farther to, okay, now who made that decision? Who reviewed that CON? And if the CON percentages are higher than we would like to see, one of the things we can do is then target our supervision to those staff and say, okay, we've had X percent of admissions being approved through this unit. Can we sit down and look at why in a particular case you felt like the inpatient hospitalization was needed as opposed to not. So it allows us to more target our supervision efforts again, so a little bit more of an efficient way to approach this. Certainly is a price tag to it, but as I said, it's an investment in having better data moving into the future. One last piece, I guess, on the data warehouse. We talked about the hospital information that's available through the for the crisis services, inpatient, partial hospitalization, diversions, those kinds of things. Other modules that we're looking at putting into place are payments, adjustments, and denial, so a financial component that will allow us to better pull financial information. One of the things that we continually do, and we've talked about it here, is when we get our interim FSR after the end of May, we'll have a better picture of where we're at. If we have this kind of module available in the data warehouse, we'll be able to look on a daily basis and say, okay, where are we in terms of our expenditures? So we'll have much more timely data to be able to look at to evaluate our finances and where those dollars are being spent. The other piece that goes along with the data warehouse is that there's a kind of an interim step between our data system focus and the data warehouse, where they go through some algorithms to verify and validate the data that is going into the data warehouse. So we have more confidence in that data that's being stored in the data warehouse, and then we're pulling from the data warehouse in order to make judgments and make decisions based on programming. So there's a validation component to this that really increases the accuracy of the information that's available to us.
Yeah, if I may. I see the need for this sort of program, and I understand the value of it, but I have a concern about spending this much money before we've restored services, since that's our primary mission. And I don't know how we justify continue to make CLS cuts, provider cuts, other cuts, or maintain those cuts, and at the same time invest large sums of money in was essentially a computer program, which is a good thing to have, and I do see the value of it, but I've also seen new computer systems that that a lot of folks I've worked with taken on that had all kinds of glitches and cost overruns and other problems. So one, where is the money coming from? And two, is this particular company been sufficiently vetted to make sure we're not going to end up with something that turns into a fiasco in terms of costs and overruns? And I guess three, those two questions are the primary ones. And the third one is, did we bid this out, or is this just a sole source bid?
We've been working with this company, AFIA, for a couple of years, and the dashboard that you have in front of you, the screenshot, is something that they developed in conjunction with our staff with grant dollars previously. So there's kind of a proof of concept in terms of the ability of them to provide us with this kind of dashboard, and we'd be moving on to a number of other modules that would have the same look and feel. The open-endedness and the ability to get out of the contract that you mentioned earlier, we do have the option to not renew the contract if we choose not to.
Notice, but it automatically rolls over.
It would automatically renew unless we provide them with notice that we no longer wish to continue. Yes, that's correct. But we do have an out in that way, in that we can cease to renew.
But you missed my questions. Where does the money come from? Number one, was the sole source bidded, or was it bid out to companies that do this sort of thing? I realize we've been working with them for some time, and what I haven't had a chance to vet the company myself, at least. We can do all that sort of things in Google, but I assume administration has, and what's the level of vetting that we've done? Those are the three questions. You missed all of them, Jim.
Okay. I don't know whether it was bid originally. Bill, can you speak to that at all? Do you know?
Well, it first came on board with, under the conference.
Can you come up to the mic, because we can't. Can you come up to
Yeah,
the
come
mic,
on up to
'cause-
the microphone, please.
So they first came on board under the grants and got engaged. At the time, we were also working some grant money under CMT. But AFIA laid a clear line out for us that made this vision really clear to us from the beginning. So no, we didn't bid it out. And I don't know how you could bid this sort of thing out, because they had to come in and learn our data from the beginning, just like they had to help us learn how to build a data warehouse. And this isn't, they don't work with me, they work with our whole team.
But how do we pick this group initially rather than, I don't know how many companies do this sort of work.
I don't either. Initially, John ran into the president, who was the CIO for, do you remember where Jeremy was president at?
The founder of most of the state of Michigan right now runs on PCE systems. That's our electronic medical record. The founder of the electronic medical record was Washtenaw County in partnership with the CFO at that point in time, who is the CEO of this company. So what he's done is, since, dissolved his relationship with Kathy Reynolds, if you remember Kathy Reynolds, and this gentleman who was the folks that put the electronic medical record together. So he went off and started AFIA. And so he understands our electronic medical record system. And we came to the board here 2 years ago or whatever with the AFIA contract. And now, as I think Bill's describing, we're learning how to build a data warehouse from them, as well as they're learning our data system, and to RFP it and have somebody else come in with a different platform. I don't think it's necessarily going to merge with what AFIA is doing. So that it wasn't RFP'd, but it's a building block of what AFIA has been able to offer us.
And as I said, they really, as much as anything, as they learned about our system and how to move our system into the data warehouse, they really laid that clear white line in the ground and said, this is how we get to the data warehouse, and this is how we build on it. To RFP this, you'd essentially be starting over.
But originally it was an RFP.
Originally it wasn't an RFP. Originally it came on under the grant. It started off with the grants towards CMT, and then AFIA came along and did some work. They were starting to work to prep data to move it into a CMT data warehouse. But we became clear that what CMT was doing wasn't what we had envisioned. And AFIA was moving us in a direction that the whole team really liked. So that's where we got, so at one point, when John was talking about our reporting and some of the things that seemed, that he didn't understand, we brought to him what we're doing with AFIA on a limited basis at this point. And the grant money's, I believe, almost gone, or some of it's almost gone. And we explained how we not only moved from the reporting request process into a reporting interview process, so we could get closer to what you're actually asking for us to report on. And then we move it into the PIP committee, and the PIP committee would look through and make sure the report was valid. And then that would then go, based on whether the data, that report was relevant to the data warehouse, would go to AFIA, and AFIA would work directly with us to make sure they got that data cleaned and vetted and moved into the data warehouse. And when we told them this process that we were doing and why we feel our reports are moving in a better direction, John said, well, what's the problem with it? I said, the problem with it, we have so little hours to work with them that we're crawling. We're crawling, and at this rate, it's going to take us years. When we received the grants, and that was through another department other than mine, but the idea of those grants is, here, get something started. But you're not going to get the grant money forever. When the grant money's done, they don't expect you just to stop working on it. They expect you to figure out a way to keep moving this awarded money forward. And this is our recommendation for how to do that. Did that answer your question?
Yeah, it makes me a little nervous on some of the earlier parts, but I think you did answer my question. What I still haven't got an answer to, John, is where were we supposed to get this money from, and how can we justify it when services are being so severely restricted?
That's it's the prerogative of the board, certainly. I understand, and I'm sensitive too, that we've cut a lot of services to a lot of people. We still have to continue to do business, and we still have to continue to try to provide what is not only necessary in the way of staffing and administrative oversight, but also technical oversight as well too. And this is just one of those things that has it's a $300,000 price tag, a small price tag, when you're looking at a $167 million budget. We'll pick up those costs inside the IS budget, the information systems budget.
We also have 2 years of grant for data culture change dollars, $75,000 a year, that would offset this cost to that extent. That would be
So
available
half.
to us.
So half of it, basically.
Probably not quite half.
Would be offset by grant.
Right.
All right, Commissioner Birdie.
Thank you. I'm concerned about the trade-off, and I don't really quite have a grasp on it yet. Let me tell you what I mean. Right now, we presently get financial information. This is an upgrade, so you're telling me we're going to get better financial information on a faster basis.
Yes.
Is that what you're saying?
Yes, and I think finance would support that. We extended some hours, some of the AFIA hours to them as some of the rules about the financing changed and some of the reports needed to be changed. And they jumped in and helped finance break up those reports like they wanted to them. The demands from the state are going to continue to get complex.
I'm trying to keep it simple.
Okay.
Don't get carried away.
All right, I'm sorry.
The trade-off now is we're cutting services across the board because the state has consistently cut us serious dollars. We're down 43 million plus other factors where consumers are being put into Healthy Michigan where they shouldn't be, and I don't even want to go into that. So it's probably in excess of 52 or 53 million as we're speaking. That's the trade-off that concerns me. In other words, the money to pay for faster information, what's the merit administratively for that against not being able to put dollars into supporting services that we've been forced to cut? That's the trade-off I'm trying to come to grips with here. And my concern is if the data is faster, what's the value of that against continuing to cut services?
Go ahead.
So my suggestion is going to be that, frankly, if I can't get wrapped around that, then I don't think this program, as good as it might be, is being presented at the appropriate time. So I'm going to suggest perhaps that we table it so that we can have some discussions that handle the trade-off. Because frankly, faster information is not necessarily better against continuing to cut services. So that's my concern, and I'm telling you up front, that's what you've got to satisfy if you want my vote. So I would suggest that rather than I vote against it, that we table it for a couple of weeks to take a look at it in the sense of how do we handle the trade-off. Because if it's not worth the trade-off, faster information isn't worth getting, Bill.
I think the term faster is gotten exaggerated here, but let me give you an example.
I'll say faster and better, if that makes you feel any better.
I would say more readily available.
But,
okay.
But again,
So-
it's the trade-off. Faster, better, more readily available against continuing to cut services. So that's what I think you need to address. Because anytime, if we can hold reasonably good, accurate data and increase cut services, isn't that perhaps a better situation? So I'm going to suggest again that perhaps tabling it might be prudent in the sense that we could have a discussion appropriately to handle and address these issues. Whatever is your pleasure, but frankly, that's my concern. It's that trade-off that really concerns me, so.
I think one of the things, and I understand what you're saying, and I'm sensitive to that as well. One of the things that perhaps is part of the trade-off equation is that as we get more readily available and better and different data available, such as the decision-making around inpatient admission. We spent over $14 million in inpatient admission last year. We think with better decision-making and use of medically necessary appropriate alternatives, that we can make a cut into that expenditure, and we can maybe save a couple of $1 million that will more than offset the cost of this, and will allow us to have dollars that are available for other services.
Do I still have the floor?
Yes.
Jim, I appreciate what you said. Don't be offended, but those are maybes. Those are maybes. So I'm suggesting that if you want to present maybes attached to this item that would maybe provide alternative savings that might be productive to the overall cost, that maybe we ought to have these meetings to discuss it. Because presenting maybes, and in the past when that's occurred, and 6 months later, when the maybes haven't been productive, and we've been adding GF dollars to support the maybes that didn't turn around, I don't want to revisit that. I'm trying to approach this in a positive manner and suggesting that if we're going to vote on it tonight, you don't have my vote, because I've got concerns. I think if you table it and we can discuss it and handle the trade-offs, and you want to present maybes, then we can talk about those, because I don't want to do it on the fly, because I don't think we're in a position to do that. We need to be positive, and we need to take appropriate steps. So, if you don't mind, that's really where I am, and I'm trying to approach it in a positive manner. So, whatever your pleasure is, I'm suggesting that might be the best way.
Thank you, Commissioner. We have a few more speakers. I'm going to go to Commissioner Vosberg and then Commissioner Bush.
Thank you, Mr. Chair. I have a question regarding what I thought I heard earlier in the presentation regarding the snapshot, and that is that you are now getting information in a better way, that you are able to analyze other decision making. So in that regard, that would be helpful to be able to use right away. Is that correct?
That's correct, and we are and will continue to use this information to do things better.
Okay, and so how long have you been able to get reports of this nature that are useful to you?
This has been in development, and I think was rolled out late last year. Would that be accurate, Bill?
So I guess I don't need to know, exactly when. What I was getting at is, have you been able to start using this data that's presented in this new way? Do you have some successes as a result of that?
We have been able to use it. The thing that comes along with this that helps it, and is really kind of a package deal, is that it comes with the subject matter expert that is, an expert at looking at these numbers and looking at the processes that created these numbers and saying, okay, well, based on this, this is what our next step needs to be. And to help us work through that is almost a project management type of capacity that comes along with it. And then periodic check-ins to see, are you getting the impact that you expected to get from this project?
And you're getting those services now?
We
through
are
that
not getting those services now. That's part of this proposal.
Okay, but that's part of this proposal, that you would have that.
That's correct.
All right.
We have just the data right now, yes.
All right, thank you.
Commissioner Bush?
I'm just wondering if there's an impact that is a cost saver that would provide, enable us to have money for services. I don't think it's a either or. I think in this day and age, with all the reporting requirements for Medicaid and the federal government and the state of Michigan, that you do have to have these kinds of systems. And I appreciate the due diligence in finding something that works for us, and that I'm not one to really speak on computers, Bill, but I know that in a workplace that's responsible to consumers and taxpayers and so forth, you have to have the proper systems to deliver that service, because that's how it gets done nowadays. I'm not opposed to studying it if it doesn't hold you up. I'm not opposed to loose suggestion that we table it. If it has to be decided before that, let me know if there's.
John's going to jump in.
The accuracy of our data that's delivered to the state has, bearing on how we're going to be financed, and it does have incredible value to the accuracy of our data. I would encourage the board. I understand that you're not settled with the pro-con value of this. I wouldn't have any objection at all, and maybe support. Not that I'm a board member here, but support the position to bring it back at the full board meeting to further clarify, what the value of the data enhancement is. But I would strongly encourage not to let the end of the month go by without approving this. I think it has significance to our future data and our future finances from the department.
Go to Commissioner Shimatero and then Commissioner Birdie.
Yeah, my problem is that the answers to most of my questions raised additional questions. So I think we should delay it and have a full discussion on it, some we can have behind the scenes between now. I'm reluctant to go to the full board without having it fully vetted by this committee, although it's the same people, so I'm not sure I know what difference it makes since we're a committee of the whole. But I would move to table this until the next Program and Budget Committee meeting to allow us to revisit all of or to find the answers to the various questions we've raised.
All right, we have a motion on the floor to table. Is there support? And then we'll have discussion. Support from Commissioner Nagovin. Is there comments? Lou, did you still want to comment?
I do.
Okay, Commissioner Birdie and Commissioner Bush.
Nick touched on a comment that I was going to make. If it was to bring it back at the full board, but not meet on it between now and then, frankly, that's just a waste of time. I mean, if we're not going to handle it, then it's just letting time go by where nothing happens. So the tabling has to be attached to how this board addresses the questions that were asked and how the trade-off is effective for better, faster, more available information as against declining consumer services in relation to the amount of money that it potentially takes. If we don't do that, bringing it back is a waste of time. So I'm just suggesting that the tabling needs to be productive or it's not gonna work, so.
Do you want to amend Commissioner Shimmatero's motion?
Pardon?
Do you want to amend his motion to table?
His motion is satisfactory as far as I'm concerned. I'm merely indicating that what John had said earlier, he said, I don't mind bringing it back to full board. But that's a waste of time if we don't meet on this subject between now and the full board. So if we don't do the meeting on the tabling motion, which makes it official, I'm saying that's a waste of time. Let's vote on it tonight, up or down, and let's go on with life. I'm saying that the tabling might be productive if the votes aren't there to save the issue, if that's possible. But the crisis is we can't continue to cut customer services and consumer services and increase computer speeds. That doesn't tell you much. So let's be productive about it, is all.
Commissioner Bush, and then Commissioner Vosberg.
Thanks. I have a question or just a comment about tabling it till the next program and budget. I'd like John to speak to why he suggested that it be handled in the month of May. And if there's an urgency if there is an urgency, then the people who have questions will have to figure out a way to get their questions answered, I would assume. I'm not sure if Lou's talking about another meeting of the full whatever, but, so, Jen, why did you say, Nick's suggestion was to wait until program and budget in June. I would be opposed to that if there's an urgency to have it done in May.
Well, first off, I wouldn't suggest that we bring it back to the full board in the same content that it is. It was intended to come back to the full board with the answers to your questions. I understand you want to discuss it, and that's the board's prerogative. I'll defer to Bill. I think time is of the essence here. Do we have, Bill, time to wait until June?
Well, at this point, their work for us is technically done. They continue to provide programming hours to keep moving the project forward, and they won't continue doing that indefinitely. But I think there's one or two data sets that they're actually donating some time to right now to complete those one or two data sets that didn't get done before the grant money ran out. So that's a.
So can we wait till June or not?
We have no hard deadline that says it has to be done before June, right?
Did you say we have no, or
We don't have a hard deadline.
And at any time they do technically donate during this time, it's just going to be programming time. It's not going to talk about any of those other issues. I'm just trying to be clear.
Mm-hmm.
Thank you, Bill. Commissioner Vosberg.
Well, thank you, Mr. Chair. I think it's important that we get the additional information. There's some serious concerns there. We can get that, but I think we can get that between now and the full board. And I would like to see a have this move, turn this motion down to postpone or to table, and to bring this issue back to the full board with some additional information, perhaps some examples of how this can work, whatever it is that we need to have. We can still turn it down at full board, but that could serve as our work session of whatever Mr. Birdie has in mind that he would like additional answers and information from about.
Thank you. I just want to mention really quick that you can pass something in committee and still vote no on it in full board, and you have 2 weeks to get the information between now and then. So you can vote to approve it now, but you don't necessarily have to vote to approve it in full board if you're not satisfied with the information you receive between now and then. Commissioner Shimatero.
Yeah, look, here's the reason I think we ought to take our time with this, and I appreciate the concern everybody has, and I think the ultimate goal is worthy. But the fact of the matter is that we have done a couple of innovative things at the administration's request that I supported, that were supposed to save us money, and we're now having to revisit them. I don't want to have to do that again. I don't want to take an innovative approach because we think it's going to work. And I quite frankly do think this will work, but at least the administration clearly does, without being very careful at assuming we know and knowing fully what we're doing, and then have to come back and undo it like we're about to discuss with Mork, like we've had with the problems with the UBHC and other things. I think it's better we take our time now and get it right than rush forward and come back and find out that it cost us more, it didn't save us the money we thought we were going to save. That's why I think the month is worth the time, and I would hope the board would agree.
All right, I'm going to entertain the motion to table. Motion from Commissioner Shimatero, and it was supported by Commissioner, I think, Nagovin, correct? Sounds like we're going to be Commissioner Vosberg.
Thank you, Mr. Chair. I just want to say again, I would encourage that we vote no on this and then come up with a way to continue dealing with it at the next full board meeting. Thank you.
Thank you, Commissioner. I think we're going to be pretty split on this one, so I'm going to go one person at a time. And I'm going to start with the motion maker and supporter. So this is a motion to table this item until the June program and budget meeting for further discussion. Commissioner Shimatero?
Yes.
Commissioner, we're going to go with Commissioner Nagovin first.
Yes.
Commissioner Gross?
Yes.
Commissioner Birdie?
Yes.
Commissioner O'Connell? No. Commissioner Kraft? No. Commissioner Schmidt? No. Commissioner Bush? No. Commissioner Phillips? Yes. Commissioner Vosberg? No. All right, it's tied, 5-5. Therefore, it does not pass. Therefore, we have an original amendment on the floor for the approval request. I have a feeling we're going to have to do this one one at a time, aren't we? All right, we had a motion. Who was the original motion from? Commissioner Vosberg? And support from Commissioner Schmidt. I feel like this is going to go the way I think I know it's going to go. Commissioner Vosberg, are there any questions or comments before we vote? Commissioner Vosberg.
Yeah, thank you. Yes, and again, I would encourage that we approve this, bring it to full board with the additional information that the members here are requiring. If you don't think we have it in the way that you need it, we can turn it down and continue working on it. But it's something that our staff has been working on over a period of 2 years, and they're dealing with some highly technical things I wouldn't begin to know how to explain. I appreciate the work that they've done, and I agree with Nick. I think they're on the right track, and I think we need to just move this forward and keep working on it. Thank you.
Thank you, Commissioner. Commissioner Nagovin, then Commissioner Shimatero.
Is enough time for the next meeting to have the information that we requested? Because I mean, if the information that's been discussed in here that we need to hear how it's working, it's not going to be available. It's not going to do any good by full board. And versus tabling it until we get a chance to get the information requested and find out what we can do and do a more deeper venting of the situation. Well, with that, I mean, we're not against this. We just need more information. If we just flat out turn it down, we're turning it down. If we're sitting, we need more information, we're tabling it till we receive that information, it's not turning it down. It's asking for the information. So if it does go to the board and we turn it down because we don't have the information, where does it stand now? It goes away. We've already turned it down.
Let me beg the question. I'll defer to Jim and the bill that do we have your deadline for program and budget will be about next Wednesday in the course of the next 7 days. Yeah, but it has to make the agenda. So in the course of the next 7 days, will your team be able to pull together a more comprehensive overview that answers some of the questions of the board members here tonight, and also any pointed questions that the board members may pass along to Jim or I that we'll give to you that can provide the clarity and the assurance that this is good money well spent? Do you need a week or do you need 3 weeks?
All right, Commissioner Shimatero, then Commissioner Birdie.
Yeah, I really think it's a mistake to take something to the full board that the committee hasn't fully vetted. Take 7 votes on this committee to move it to the full board. I reluctantly am going to vote no because I'm not ready. I don't have the information I need, and I'm not going to vote yes here and then no at the full board meeting. That's not the way I operate. I want to know that I'm doing the right thing before I move it from committee to the full board. So I'm a no vote at this point, and I think it's unfortunate that we're not taking the time to fully vet the proposal.
Commissioner Birdie and then Commissioner Bush.
I think, frankly, the strategy I've heard is just flat out not prudent. Pass it tonight, and if you don't like what happens in the next week, then vote it down at the full board, and then it's gone. That's not prudent, and I didn't realize, if you'll forgive me, that I was with a bunch of Mississippi gamblers here on the basis of shooting craps for something as significant and expensive as this, to not get it right if we're going to do it. So I'll tell you candidly, I'll move no on the motion tonight, and we'll see what happens at the full board if you get it that far. If that's the kind of gambling game you want to play, I'm in. But I'll start with a no vote because, frankly, I don't have the answers to move forward. And as I said as gently as I could to Jim, we've had some maybes in the past that haven't worked out. Now, if you'd like me to get specific about those maybes, I would be very happy to. And if you know, I can quote dollar amounts very significantly and very accurately. I don't want to do that again. I don't want to play with maybes. I want to do it right if we're going to do it. So I'll tell you candidly, that's my position. I don't think what you're doing is right, and I don't think it's prudent, and I won't support it. So.
Thank you, Commissioner. I have full confidence that Macomb Community Mental Health can give us the answers we need in the next couple days, but I will defer to Commissioner Bush for another question.
I just have a comment and then a question. My comment is that John can tell you what I would do, and I would call him in the morning and say, I don't understand this. Can I come in? Can you? This one would require me to come in because it's computers. But, you know, he would answer my questions. I would get my questions answered before I voted, whenever the vote was. And that's how I would do it. So my question of you is, what is your vision for how we will get our questions answered? Are you talking about a committee meeting? Are you talking about a month to have to read something? You could read it in a week if they have it. So my question is, what are they suggesting that we do to get our questions answered?
I think that's an excellent question, Linda, and I'll give you what I hope is an excellent answer.
Commissioner Birdie, please be quick.
What
we
I
have a lot
want
of
to
items
know
on the agenda.
is the added money here for faster data worth not being able to improve consumer services? That's a simple question of where do you put the dollars? And I'm not satisfied tonight that getting information faster versus continuing to cut services is a good position to be in presently. So that's what I'd like answered.
You didn't really answer Commissioner Bush's question. Commissioner Commissioner Bush.
We've had a lot of questions about things that cost us too much that impact our ability to give the money to the clients. And we get, and you don't go along with that. So I don't know why this one's so important.
Commissioner Vosberg. Commissioner Birdie. Commissioner Vosberg has the floor.
I don't want to repeat myself, so I won't, but I will say something different. You don't, if this gets approved at this committee meeting, it goes to full board. If at full board we need additional information, we can table it then, or we can send it back to the committee to get the additional information. It's not an all or nothing. It's not like we're going to vote it down. If we vote it down, we don't have to vote it down. We can just send it. There's other options, and I assumed the board knew that. When I say vote it down means there's additional options. You can send it back. We'll keep working till we get the information we need. Thank you.
All right, seeing no other comments, we are going to go ahead and vote to move this to full board. We will start with Commissioner Vosberg. Yes. Commissioner Schmidt. Yes. Commissioner Phillips. Yes. Commissioner Bush. Yes. Commissioner Kraft is a yes. Commissioner O'Connell. Yes. Commissioner Nagovin. No. Commissioner Birdie. No. Commissioner Gross. Yes. Commissioner Shimatero. No. Motion passes 7-3 by my math. So we'll move to full board. And please have answers to our questions by then. Thank you. Next we have where are we? MCOSA fiscal year 2018 mid-year amendment. I'll take a motion to approve. Oh, motion from O'Connell, support from Commissioner Bush. Is there any questions or discussion on this item? Commissioner Bush.
Why is, I see that, two things that I have a question on. Why is care being cut on their peer recovery budget? And why is the Salvation Army getting such a big increase? Was it just underestimated, or they started really, or they built new beds, or?
Well, basically, please remember that what we're doing here is just shifting funds from one provider to another based on utilization rates. So if one agency is doing very well and they're generating more clients and more billings that way, and we've got another one like we have with Meridian CPI, we're going to switch that money, because what we need to do is we need to be able to make those monies available so we can spend it all out at the end of the year. At least that's our goal. The CARE is just, and that's another piece that CARE has done a lot of new recovery coach work this year. They had the STR funding, they had the RFI funding, they had money from us, all for new projects in the area of recovery coaches. They saved some money in the earlier part because it just things didn't get implemented quite as quickly. But if you look, that money stays within CARE, and they found another place for that, I believe. Yeah, so we're just shifting it around, but they lost. They also. So that's basically why. Dollars or cents. Also, one thing I didn't mention in here is that we also allocated money to a new provider that you approved of a few months ago, and they're finally getting up and running. That's Personalized Nursing Lighthouse. They have residential and detox for us. They got a brand spanking new facility out in Madison Heights, and I went to a open house last week, and looks very nice. Actually, it's a renovated. It used to be run by DMC. It used to be a psychiatric unit that's been renovated since. So, anything else?
Did you have any other questions? No? Okay. Any other questions or comments on this item? All right. Seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Passes.
Thank you.
Thank you. Next is the approval for Experis Medicaid verification audit to Macomb County Community Mental Health and Macomb County Office of Substance Abuse. I'll take a motion to approve. Motion from Commissioner Birdie. Support from Commissioner Nagovin. Any questions or Commissioner Shimatero?
Yeah, just one question. Did we bid this one out?
The board bid this one out 3 or 4 years ago, and so every year we bring back a statement of work. So we're still operating within the procurement of.
Oh, this is the one we used for the last couple of years?
Yeah.
Because usually we try to change every few years. 3 is not too long.
We've used this provider for 14 years.
For?
About 14 years, since we started to have to do this as a contract requirement. But every year, not every year, every 3 or 4 years within the approval of the board, then we let the RFP, and then we go through fair procurement.
Any other questions or comments? All right, seeing none, we have a motion and support. All in favor signify by saying aye. Aye. All opposed? All right, motion passes. Next is approval of Macomb Oakland Regional Center rate modification. I'll take a motion to approve. Commissioner Birdie.
I would make a motion to table this item to set up the communication meetings requested by the director of Mork. I think his request is legitimate and appropriate, and I think that meeting should occur.
We have a motion to table this item. There's support from Commissioner Nagovan. Any comments, discussion, questions?
If I can.
Commissioner Shimatero.
Yeah. Maybe it isn't correct under the motion to table, and I think it's probably a good idea to do that, but John, we went to the fee-for-service on the grounds that it was gonna save us a whole lot of money, based on the recommendation of the administration. What went wrong?
From my vantage point, now we've been meeting with MRC, monthly, twice a month. And, the last meeting I was in, there was 17 people in the meeting. So we've been meeting with them, and there's been open communications with them. It's a sizable contract. Quite frankly, I believe that in our fee-for-service arrangement that we went to, that they billed us for services that were not medically necessary, and they're being reviewed at this point in time by our corporation counsel, and we're going to send a report to the Office of the Inspector General. And in the meantime, we are required, and we promised this board, a cost-neutral budget or cost savings. We are barely coming in at cost-neutral. We have never reduced MRC rates. Of all the providers, we reduced rates 5%, 12% for the acute psychs. We have not reduced MRC's rates. And now, aside from the statistics you were provided, this is indicative of a 1.5% reduction for this year, 1.5. And next year, it's equivalent to about a 2.2 a 6% reduction, $2.2 million. So we've been very kind and very fair with MRC. We meet with them regularly. We're modifying all of their clinical services rates to align with what our industry standard is on relative to clinical services rates. So we're proposing to them the average rate, but I'm here to tell you that the utilization that we are looking at is under review.
And secondly, I've been a big fan of Mork for years and years, but recently we've had a number of rights violation issues and saw a television program. I know you've been looking into that. Have you been able to resolve those questions?
I have been one of the strongest, and not just myself, it's not about me. I think MRC is an excellent provider. I want partnership out of MRC, and I'm not getting it right now relative to this fee-for-service contract. You can ask anyone on my board or anyone on my staff, they'll tell you the same thing. There's a concern that we have here. We're investigating it, and what we want is, and I've had numerous lunch meetings and meetings with Mr. Bott. I want cost neutrality. I want cost savings. I'm not seeing either one of those right now. And I think this will give us a little bit of cost savings. Next year, it forces MRC into thinking things differently as a cost savings.
Yeah, I agree that Mork has been a tremendous partner over the years, but I'm not trying to suggest otherwise. But there were some current issues that occurred. I know you were investigating them. Am I correct in interpreting your remarks that those investigations are ongoing, or have they been concluded?
I think there's one recipient rights investigation that's ongoing, and I don't think it's been concluded yet.
Okay.
And if you're, I think we all know what one we're talking about.
Okay, thank you.
Any other comments or questions? Commissioner Bush.
I'm just a statement. I'm concerned that John says that the cut is like 1.5, and the testimony from Mork was 18.5% to 83% in some line items. Or so that's concerning to me. That's a real. That's a real.
The budget is $37 million, and we're asking for a fourth quarter reduction of $600,000. Do the math. It's 1.5%. I think the point that Mr. Bott was trying to make, that some of their clinical services are 83% higher than what the industry standard is. I'm just asking for the average. My staff have worked with MRC. We've done this. We've met at length with them. Agreed. We did give them the final rates on on May 4th. But I don't have an obligation to find common agreement with the provider. I mean, we're not that far apart. $600,000 is a lot of money to MRC. $600,000 is only 1.5% of the budget. And I think that it's prudent for us, because we did fund CEO tonight, and we did fund, Friendship House. And in some cases, this board needs to go about the business of increasing rates. And in some places where it needs to be corrected, we go about the business of decreasing rates. So a 1.5% reduction, I think, is necessary and pointed.
Commissioner Bird, you made the motion to table. Did you have a specific date in mind?
Well, I would say to the next program and budget meeting to give them an opportunity to meet to come to some sort of communication conclusion. But I have a question.
Go ahead, Commissioner.
The second line says recommendation to apply MCC MH current provider network average savings to Mork. See attached for details. There was no attached, or there is not any attached. So just as a matter of curiosity, not in my packet. Well, it then goes to the next item, which is the estoppel certificate for the outfit on Garfield. I have no attached.
It is in the electronic agenda. If you pull it up on the iPad, it's on the electronic agenda.
Do I have this at home when I prepare for meetings, Jim?
No,
Okay. I don't.
Okay,
There was
I'm
no attached in my packet, is what I'm saying.
It's on
your screen. Commissioner Bush, was this? I have you on my list. Was that from last time? Okay. All right. We have a motion and support to table this until June's program and budget meeting.
Yes.
We have a motion from Commissioner Birdie and support from Commissioner Nagovin. So I will start with Commissioner Birdie.
Yes.
Commissioner Nagovin.
Yes.
Commissioner Shimatero.
Yes.
Commissioner Gross.
Yes.
Commissioner O'Connell.
No.
Commissioner Kraft is a no. Commissioner Schmidt.
No.
Commissioner Bush.
Yes.
Commissioner Phillips. Commissioner Vosberg. No. Motion to table passes 6-4. So we will table that item until June's program and budget.
Point of clarification, what further would you like?
Say again?
Is there something further you would like for us to present?
Well, in Dennis's handout, he's discussing certain areas of concern. I think that they need to be addressed to the satisfaction of both parties. I think our relationship with Mork provides that opportunity. I think he's entitled to make that presentation and to present the facts to us to finalize the decision. I think not to do that would not be appropriate. So, and frankly, if I could get emailed to me that copy that is now electronically here, I think I'd like to see that, because I didn't have an opportunity, it wasn't included in my packet, see it for tonight's meeting. So that would be beneficial, but I think the opportunity to communicate what differences are existing between us, given our long-term relationship, is appropriate. I'd like to see that happen.
Commissioner Bush?
In answer to John's question, something I'd like to see is more information on, I'm not sure the details, but overpayment, overbilling that you told us about tonight. Thanks.
My compliance officer is doing a comprehensive study on the overbilling piece, and that may take months.
Oh. Do a sample.
Any other requests? All right, seeing none, that item has been tabled. Next, we will go to item L, the Stoppel Certificate Commercial Facility, 43800 Garfield, Clinton Township, Michigan. Motion to approve. Motion by Commissioner Birdie. Support from Commissioner Vosberg. Any questions or comments on this item? All right, seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. Next, we are on the letter M, Board approval of residential lease A. I'll take a motion to approve. Motion from Commissioner Vosberg. Is there support? Support from Commissioner Nagovin. Any comments or questions on this item? Commissioner Shimatero.
Yeah, I noticed the provider here is closing the home, or is there going to be somebody taking it over? I assume we're in making preparations for moving the residents prior to the close.
And Tracy, can you help me out on that?
Yes, sir. It's actually the landlord that's closing the home because they're actually taking the home over themselves.
Okay.
And that's actually why we signed such an unusual time frame, because it allows us on our end to relocate the consumers with enough time and also, meets the landlord in the middle.
Thank you.
Any other questions or comments? All right. I know how, thank you for, all in favor signify by saying aye. Aye. All opposed?
I am opposed because publication of this contract without including the address is inappropriate.
Thank you, Commissioner. Motion passes. Next is letter N, request out-of-state travel to, Oconomowoc, Wisconsin for the Office of Recipient Rights. I've been practicing that. I'm sure it's beautiful this time of year. Motion from Commissioner Birdie to approve. Support from Commissioner Shimatero, I think. Yep. All right. Any questions or comments on this item? All right. Seeing none, all in favor signify by saying aye. Aye. All opposed? Motion passes. All right. Next up is item 5A, receive and file 2017 MCCMH Board Report Policy Development Revisions. Did you want to speak to that, John?
Not necessarily. Kimberly routinely does policy updates and modifications, and I think she's given you a summary of some of those. Did you want to speak to them at all, Kimberly?
They're all the ones that the board approved last year, so you already approved it. It's just a report reminding you of what you did.
Perfect. Any comments or questions on this item?
Having done such a good job, I vote that we receive and file this report.
Motion to receive and file. Support from Commissioner Nagovin. All in favor signify by saying aye. Aye. All opposed? All right. Report is received and filed. Thank you. Next, we have resolutions. We have no resolutions. Other agenda items. Do any commissioners have other agenda items? Commissioner Bush, reluctantly.
Well, I don't know if this is where I say it, but in terms of the public comment tonight, I think we all, is this where I can say that? I just appreciate so much the people who came and spoke to us, because that puts a face on what we do. And I was so struck by what Paige's father said, because I totally agree that as I looked around the room and the people who had difficulties getting here, I thought of the hundreds or thousands of people who couldn't get here tonight, and that, we have a responsibility to act in their behalf too. So if anybody's still here from CEO, I appreciate all the people who came and spoke on their behalf and all the other clients consumers who came before us. And as always, it's very disturbing to not be able to ask questions or get follow-up, but there's a couple that I'll be calling John about tomorrow to find out a little bit more about what was stated tonight. But this is why we do this, but it's not, so I appreciate people coming.
Thank you, Commissioner. Anyone else have any comments? John, did you have anything else? Briefly, we're catching up to the timeline.
I sent you the email relative to 298, and 298 was going to springboard itself on October 1st of 18, and now they've delayed it to October 1st of 19. Tomorrow, the county executive is in the lobbying firm, our meeting with the Speaker of the House, perhaps to talk about our $7.5 million smoothing that we're looking for. And the state budget office did report out on, and I think I've already told you this, reported out on over the weekend and sent a recommendation to the legislature to restore the $60 million of the $120 million in DAB migration loss. So that's favorable. If we can get that $60 million, if that actually does fall into the budget in the next few weeks here, then, and it's applied for 18, that would be about $4.9 million to us. So that's a big lift for us. That's all.
Thank you, John. Commissioner Nagovin.
Did they say they have a time frame when they're going to take it to the legislators?
I thought it was going this week still, that they were going to take it in.
Anyone else? All right, seeing none, we will close other agenda items. On to the hearing of the public. Anyone from the public wishing to speak? I'm going to cut you down to about 3 minutes because we got to be out of here.
I'll be real quick.
Thank
Derek Harwood, CSDD. I just want to say that all-day programs should receive the equally distributed rates. You can't just give CEO an increase and not anyone else, as we were all cut. We would like to place equaling all-day programs on the next meeting agenda, as we all provide the exact same services. Thank you.
Thank you. Anyone else from the public wishing to speak? Going once, going twice. All right, we're closing the hearing of the public. I'll take a motion to adjourn. Motion from Commissioner Vosberg, support from, I think, Commissioner Bush. Commissioner Phillips. All in favor signify by saying aye. Aye. All opposed. All right, we're adjourned. Have a good night, everybody.